Patients come in saying, I've had a severe headache almost every week, every month. Do I have a tumor? And that's unfortunately the first thought that enters patients' minds when they have headache, especially if it leads to nausea, sensitivity to lights or sounds, visual disturbances. Here's the good news for everyone out there. Tumors, brain tumors in particular, are the least likely cause of recurrent throbbing headaches. In fact, not the most likely cause of headaches. And the reason for that is because the brain itself, the actual gray matter, white matter, and brain tissue does not have pain receptors. So, in fact, neurosurgeons in the operating room are often poking the brain with instruments, and patients do not feel anything with respect to pain. So then why do some patients end up having headaches from a brain tumor or from an aneurysm rupture? Well, we can go into that in more detail, but if the brain tumor in fact is causing an increased pressure in the brain, where the outer lining of the brain structure is stretched, and that is the dura mater, or it's compressing sensitive areas of the brainstem, for example, that's triggering inflammation of the trigeminal nerve, whether by direct compression or more likely the stretching of the dura mater, well, that can cause pain. Or blood vessels. The blood vessels are enriched with receptors that can trigger pain. So an aneurysm rupture causes a massive, severe headache, as they say, the worst in your life. And it's very sudden, and it can lead to loss of consciousness or a coma. And that's because the aneurysm is a weakness of the walls of an artery that leads to rupture when under a lot of pressure. And so the blood vessel, in fact, is stretched. The walls of the blood vessel is stretched, causes severe headache. So if you ever experience the sudden onset of worst headache of your life, of course, you should always consider going to the ER or urgent care for immediate evaluation, especially if you're experiencing changes in your mental status, you're becoming drowsy. So that's very important.